Countries around the world have begun or are on the verge of rolling out the vaccine for its citizens, but the mammoth task of storage and distribution of millions of doses stares at them. And now the world is looking towards India, the largest vaccine manufacturer, to play an instrumental role in making vaccines available to even the remote corners of the globe.
After almost a year of gloom and fear, a year of death and disappointment, the days of the pre-pandemic era are finally appearing to be returning. Yes, the long-awaited Covid-19 vaccine is here. 90-year-old British Margaret Kinney became the first person in the world to receive the Pfizer Covid-19 vaccine shot outside of a trial. Hundreds of others have received the shot in the United Kingdom after this US vaccine was approved by London following its efficacy results of up to 95% after the second dose. Many other countries are considering it on priority. Dozens of other vaccines too are set to be rolled out in few weeks. But will that be a victory moment for mankind? No. In fact, the beginning of a mammoth challenge of producing them in millions and delivering them to remotest corners on the planet. With vaccines requiring specific freezing temperatures to sustain, the task becomes even more difficult. In such a scenario, the world has turned to India, the largest vaccine manufacturer in terms of capacity. The Indian companies are already working strenuously to brace up for the challenge. From vaccine container manufacturers to cold chain specialists and logistics companies, firms in India are getting set for the massive global blitz to contain the pandemic by freeing up capacity and accelerating investments even without firm purchase orders.
We are making sure that, as we said, we have added 300 million capacity, so we are making sure that we are geared up and can satisfy and hopefully give them everything they need on time.
India manufactures more than 60% of all vaccines sold across the globe. And while its $40 billion pharmaceutical sector is not involved in the production of the expensive Pfizer Inc. and Moderna inoculations, the country will play a pivotal role in immunizing much of the world. Indian companies are set to produce 8 more affordable vaccines designed to fight Covid-19, including AstraZeneca's Covid Shield, dubbed as the vaccine for the world by its developers. The country is also reviewing applications from Pfizer Inc., AstraZeneca and Hyderabad-based Bharat Biotech for emergency use. Observers say it will be incumbent upon India to not only deliver the vaccine to its own people, but to the entire world, especially the poor countries.
The vaccine is going to trigger a large amount of activity in and around the manufacturing of vaccines. So therefore, the entire thing end to end needs to be managed well in the context of vaccine logistics. And therefore, the position in India is very, very unique compared to any other country globally.
Meanwhile, more than 60 heads of foreign missions visited manufacturing facilities in southern India as one of the world's leading pharmaceutical centers stepped up production of Covid-19 vaccines. The foreign delegates visited Biotech's facilities in Hyderabad, where the firm is developing a shot called Covaxin in collaboration with the government-run Indian Council of Medical Research.
India's capacity for mass producing vaccines is something that will, I think, make a huge difference in the fight against coronavirus.
The country of over 1.3 billion has announced that it will be rolling out its vaccine program in just a few weeks and will be vaccinating 300 million people in its first tranche. The country's COVID caseload of around 9.7 million has witnessed a significant downfall in infection rate in the past few weeks. From nearly 100,000 cases per day in mid-September, the daily infection number stands at around 30,000 per day. The country has one of the fastest recovery rates, with its mortality rate amongst the lowest. Observers believe a slow infection rate in India would be a boon for the rest of the world, as only under that situation can New Delhi afford to send more vaccines in other parts.